let's talk about erectile dysfunction and how it impacts the heart. Now, erectile dysfunction affects over 52% of men between the ages of 40 and 70. So as you can see, it's quite a widespread condition, very common. My biggest frustration with this is that when I talk to patients who have been diagnosed with ED, most of them think it's only related to sexual function, and they have no idea how it could affect their overall health. Because when I see a patient who's had the diagnosis of ED or erectile dysfunction, I'm immediately thinking of heart disease because the two are intricately linked. As I said, there's a relationship between erectile dysfunction and cardiovascular health because they have shared pathways, shared underlying mechanisms, both of them involving blood vessel dysfunction. This means that the blood vessels are not functioning properly. There's a lot of inflammation going on. And so while that's happening in terms of your sexual organs, that's also happening to the heart as well. It's an early warning sign for heart attack, heart failure, or stroke. And importantly, erectile dysfunction appears 2 to 5 years before heart disease symptoms. So it's sort of a warning sign when we see ED that we should be paying attention to the heart. To just really drive home this point, here's an article from the American College of Cardiology from 2014, and I'm going to quote directly from it. It says here, the importance of evaluating cardiovascular risk in men with erectile dysfunction is now a critical factor for overall early stage management of heart disease, especially in younger men between the ages of 30 and 60. Because obviously, if we can pick this up early, then we can jump in and hopefully prevent downstream effects. In their conclusion, they add that vasculogenic erectile dysfunction, and again, this means erectile dysfunction from problems with your blood vessels, right? Which is the most common way that people have erectile dysfunction. So ED should be regarded as a harbinger of silent or future heart disease. Cardiovascular risk stratification is an essential component of clinical management in all men with ED. And here is another article. This was put out by the American Heart Association in 2018. And it says erectile dysfunction may be a warning sign for more serious health problems. Again, the quote, a diagnosis of erectile dysfunction is associated with a twofold increase in heart attacks, strokes, and cardiovascular death beyond traditional risk factors. And when they say traditional risk factors, they mean things like smoking and diabetes and obesity and so forth, right? So beyond that, it actually increases the risk of heart attacks, strokes, and cardiovascular death, 2 times increase, all right? So this is a very serious thing. Now, as I mentioned earlier, there are shared risk factors for ED and heart disease. Very commonly, we will see diabetes. Both ED and cardiovascular disease very much associated with diabetes. Why? Because diabetes is a condition that causes damage to blood vessels and nerves, right? So we're damaging blood vessels and nerves in the penis and also in the heart. What about hypertension? Yes, high blood pressure can impair blood flow, and this is also going to contribute to both ED and heart disease. So we want to make sure that we control hypertension, otherwise we could develop both of these conditions. Obesity and metabolic syndrome. These conditions are linked to inflammation, insulin resistance, and endothelial dysfunction. This means, again, blood vessel dysfunction, right? A lot of inflammation in the blood vessels, which can impact both sexual and cardiovascular health. Really important to detect early because it's when we see ED, it's really a warning sign for potential cardiovascular problems. And if we screen early and we intervene early, then hopefully we have better outcomes downstream. Now, the shared risk factors are high BMI, obesity, smoking, diabetes, and high blood pressure, as well as high anxiety states. What should you be evaluated for once we know that you have ED? Well, first of all men should be asked about sexual function, not just to address sexual health, but to address how healthy your heart is. And once we know that you have ED, we should immediately look for visceral fat. This is the kind of belly fat that a lot of men accumulate over the years. We should look for insulin resistance, and this is a hormonal dysfunction that is also related to that belly fat or visceral fat. We should look at blood tests and be assessing kidney function, right? Because, we can have signs of maybe early kidney dysfunction happening if you have ED. So we should be looking out for those. We should check your blood pressure, make sure that if you have hypertension, we really get aggressive about monitoring and treating that. And we should also look out for sleep apnea because that also directly impacts your blood pressure, right? So when you have sleep apnea, people think that it's just, something to do with snoring in your sleep and so forth. But sleep apnea is a condition that causes a lot of stress to your heart at night, and it can raise your blood pressure. And this doesn't just happen in people who snore. You can have sleep apnea and not snore. You can be someone who doesn't have obesity and still have sleep apnea because it's just a function of your anatomy. So depending on the anatomy of your face and your neck, right, you might have a structure that blocks airflow and causes obstructive sleep apnea. And if you have that, you might not know unless you get a sleep study. And then, of course, we want to do further testing. So that might be an exercise stress test on the treadmill and some imaging studies to look at the heart. Okay, so if you have ED, it means you have problems with your heart as well, right? So the both are related. So what can you do to improve both your sexual function and cardiovascular health? Well, we have here physical activity because regular exercise helps improve blood flow. It can decrease inflammation and enhance sexual and cardiovascular function. We definitely have to do a reassessment of your diet. Make sure you have a balanced, nutrient-rich diet to support your health for your heart and also for, your sexual function. Definitely cut out processed foods. You don't need those. Cut out sugars from the diet. You don't need those. Remember that high levels of sugar in your blood will damage blood vessels, and that's what we're trying to avoid. We're trying to avoid more damage to those blood vessels and also to the nerves. Stress management, right? It's very important to manage your levels of stress, to manage your anxiety. You saw how anxiety is related to development of ED and also to poor cardiovascular health. So maybe using practices such as meditation, relaxation, and so forth can help impact your sexual and cardiovascular well-being. Remember what I said about sleep. This one is missed so much that I feel I have to drive the point home. Whether you snore or not, whether you have obesity or not, get a sleep study if you've been diagnosed with ED because untreated sleep apnea will stress the heart and lead to heart failure eventually. And once you've been diagnosed with sleep apnea, you will be asked to use certain devices, most commonly CPAP. And it's not something that people get used to immediately, but do persist. Give it a good month to try out using the device because it's really important that you give yourself a chance to get used to the machine and let it do its job of giving you better quality sleep and good oxygenation during your sleep. So the main takeaways that I want you to have from today's presentation is that when you see erectile dysfunction, you've got to be thinking immediately about your heart because it's an early warning sign of underlying heart problems that you might not have noticed, right? There are shared risk factors, diabetes, high blood pressure, obesity, also smoking. Quit that. If possible, get help from your healthcare provider because that's also impairing your health overall. Effective management of ED and your cardiovascular health can be done with a combination of medical treatments and lifestyle modifications. And there's a lot you can do to improve both your sexual function and your heart health. So make sure you start straight away. All right, that was what I wanted to talk about for today. If you have any questions on ED, on heart health, make sure that you reach out to me and I'd be happy to answer them. Look up my website, vivianlohmd.com, VYVYANELOHMD.com. Take care.